Vitamin B12 deficiency can wreck your health. And the scary part is, deficiency of this essential vitamin is super common. It's estimated that as many as 40% are deficient, and if you're on a plant-based diet, it gets much worse. Pooled research studies show that 21 to 85% of vegetarians are deficient, and like I said before, vitamin B12 deficiency can wreck your health. So stick with me. I'll get to the symptoms in a minute, but first, if you're new to the channel, I'm Dr. Osborne, and the reality is millions are sick, struggling, and frustrated. That's because our healthcare system sucks. Doctors aren't trained in diet, lifestyle, or nutritional medicine, and the system incentivizes pharmaceutical profit over human connection. It's like a bad date. The food was awful, the person sitting across the table isn't interested, but you're stuck paying the tab anyway. So back to vitamin B12. When your levels start dropping, some very dangerous things start to happen. Number one, your red blood cells become clumsy and struggle to carry oxygen, aka anemia. This leads to severe fatigue, brain fog, muscle pain, and exercise intolerance. Number two, your body's ability to make serotonin becomes hindered, leading to increased depression and anxiety. Number three, your body can't metabolize homocysteine. This chemical can build up in your system, increasing the risk for nerve damage, kidney damage, bone loss, heart attacks, and strokes. Now, the symptoms don't all start at once. They usually come on slowly. You might wake up a little more tired, experience some migrating aches and pains, find that you just don't have enough energy to exercise like you used to. You might find yourself feeling sad more often, even when life is good. You might find yourself getting overly anxious about things that never bothered you before. This is what makes vitamin B12 deficiency so dangerous and insidious. The symptoms start gradually and don't prompt the need to investigate right away. By the time serious symptoms set in, the systemic damage can be debilitating. You should check out Mary's story for more on this. Mary spent more than $40,000 in ER trips, doctor's visits, and testing, only to find herself with a fistful of prescription drugs that did nothing for her. Bottom line, vitamin B12 deficiency can cause major health problems. A study published in BMJ found that many with B12 deficiency frequently reported the following symptoms: memory problems, cognitive impairment, insomnia, headaches, especially migraine, behavioral changes, learning problems, irritability, depression, anxiety, hallucinations, delusions, psychosis. Yes, B12 can make you crazy. Pins and needles, numbness, neuropathic pains, poor balance, fatigue, anemia, infertility, urinary tract infections, muscle weakness, degeneration of the spinal cord, seizures, cardiomyopathy, incontinence, dizziness, and fellas, erectile dysfunction. All right, before you tune out, you also need to know what causes vitamin B12 deficiency. These things are super common and affect more than 100 million people worldwide, and I can guarantee that if you're not being affected by them, someone you know and care about is. Take a look at this diagram. Specifically pay attention to the things I highlighted. 280,000 performed gastric bypasses every year. Bypasses cause B12 deficiency. The infection Helicobacter pylori, or H. pylori, more than 1.2 million cases diagnosed annually. Bacterial overgrowth or intestinal diseases causing inflammation affect more than 2 million people. 42 million people have difficulties in chewing, including folks with dentures and dental problems. Now, beyond the diseases, look at the medications that can cause vitamin B12 deficiency. Proton pump inhibitors. If you're taking acid-blocking medications, beware. Blocking stomach acid causes vitamin B12 deficiency. Let's look at the numbers of people doing this. You can see in this study, search identified data from 28 million PPI users in 23 countries from 65 articles. This review indicated that nearly 1/4 of adults use a PPI. In essence, 25% of you are blocking your stomach acid, causing vitamin B12. And what about metformin? one of the most prescribed drugs in the world. Nearly 120 million people are taking this medication. Western medicine's greatest accomplishment, a healthcare system that can't fix a diet and lifestyle disease. In the U.S. alone, we spend over $6 billion annually to treat people's food choices while driving a mass epidemic of vitamin B12 deficiency. The irony? Where do I start? Is diabetic neuropathy a blood sugar problem, or is it a metformin-induced vitamin B12 deficiency? You'll never know because all the mainstream trust the science doctors are saying that nutrition deficiency doesn't exist in the modern world. Please excuse my cynicism. But after decades of practice, I'm still waiting on the day I see a doctor measure B12 in their patients they put on metformin, even though their own peer-reviewed literature recommends it. Drop a comment if you're frustrated with your doctor's lack of nutritional education. And those of you following the anti-aging trend of using metformin for longevity, better get your B12 levels checked before you order that entree of dementia with a side order of living long and becoming a burden to all of your loved ones who end up having to take care of you. The system won't fix this. It's on you to take your health back. If this information resonated with you, get your B12 levels checked and take action. Join me, follow and share this video, and help me expose the truth because I'm on a mission to save 100 million lives and I need your help.